Ocean Pines is a vibrant residential community nestled on Maryland's eastern shore. With over 9 miles of waterfront property, amenities like an 18-hole championship golf course and a public yacht club, and a rich history dating back to 1968. Of course, if you live here, you probably know most of that. And if you don't, it's almost all apparent from your first visit. Each week on the Pines Cast, we work to bring out the ocean pines that might be less apparent. We celebrate the region, the amenities, and, most of all, the people who make and keep Ocean Pines a special place to live. Welcome to the Pines Cast, your source of news and insights about Ocean Pines and the official podcast of the Ocean Pines Association. Welcome back. I am your host, Tony Russo, and this week we have two guests at the same time. We have Laura Blair, and she is the Director of Business Development for Coastal Hospice, and we have Nancy Stewart, the Director of Access and Palliative Care for Coastal Hospice. It's a really great conversation, and they dispel all sorts of myths and rumors about hospice and talk about, the practical reasons for taking hospice seriously. So I will catch you on the other side, and let's just get right into the conversation here. So welcome, and thank you so much for joining me here today. Since there are two of you, let's get you each to introduce yourselves so that way it's everyone knows who everyone is.
Sure, absolutely. I'm Lauren Blair. I'm the Director of Business Development at Coastal Hospice.
And I'm Nancy Stewart. I'm the Director of Access and Palliative Care Services.
What does the Director of Access do? That seems specialized.
Access is another term used for admissions.
Oh. So I do want to tell you, without getting too inside baseball, one of my jobs is I write for the funeral industry. And so as part of that, I do a little bit of hospice coverage for obvious reasons. But I've learned so much about hospice that doesn't have to do with death over the last 3 years. It's been really, really amazing to me. And so I think that we want to at least talk about that a little bit. And also just kind of what you do. But before we get into all of that, how did each of you come to get this gig, and what do you do it for?
That's a great question. So I worked in a long-term care facility for about 10 years before I came on board to hospice. And Nancy would actually come and visit our facility and just talk to us about hospice and all the many great benefits. And through that, I started referring more and more of my patients to hospice. And it really showed me how helpful it was, even in a nursing facility. I mean, there's so many things that the hospice folks were able to do for my patients and my staff. We had a nurse come out and support our nurse and make medication recommendations, and an aide come out and kind of take away some of those duties from my nursing aides, just to be able to even feed someone for half an hour, 45 minutes just takes up so much time. And so, I saw the benefit for hospice to come out, but especially I saw the benefit for the patients in a spiritual aspect and a social work aspect, having someone come visit them, support the patient, support the family, sing a song to the patients, especially like in the dementia unit, the patients sometimes were nonverbal, but when, Joel, our bereavement and spiritual care would come and sing to them, they would light up and some would even sing back. And it was just amazing to see. But then the aftercare, a lot of our patients had been on our unit for many years. And when they passed away, the families were just kind of distraught because that was where they came every day to visit their loved one, or once a week, or, once a month, however often they were coming, that wasn't a solid for them anymore. So they didn't have that support, and that wasn't really something that my staff could then provide for them. So I loved the aftercare part where bereavement would stay in touch with those families and just provide that emotional care that me and my staff couldn't provide. So I always referred to Coastal Hospice because all those great things I saw. And then, when the opportunity came along for me to join the team and kind of be the one out there educating those facilities and those doctors' offices, I jumped at it.
That is absolutely fantastic. And the new hospice is not the old hospice, I think,
exactly.
is the way to say it. And it's one of those things that I think unfortunately, for too many people, they have to experience it before they understand that, oh no, this is really just a course of treatment. Not just a course of treatment, but it's really a course of treatment.
Yeah,
You
really.
know?
It's a different way to go.
And how about you, Nancy? What got you involved in hospice?
Well, I was in another area of healthcare marketing, and that was no longer really a very stable industry. So I actually started working for a hospice in Delaware doing marketing, and I had the opportunity to come to Coastal Hospice. And I, too, like Lauren, jumped at the chance to do that because I had those relationships in the community with the facilities and all of the providers' offices. And I wanted to stay in healthcare marketing, and I couldn't think of anything better than being able to bring this type of service to patients, their families, their healthcare providers who just don't know how to better help them and needed someone to be able to take over for them when they got to that point where their primary care physician or their specialist may no longer have options to give them. They needed to make sure that they had a very supportive and well experienced type of program and service to um, pass them along to someone that they trusted and knew that they would take care of not only them, but their families as well. So I did start in marketing at Coastal Hospice. And then a few years in, I transferred over to access or admissions, like we said. And that's been just as rewarding um, because I can actually see exactly what we're doing real time, day in and day out. And the difference that it makes, I can't even really put it into words. It's something you have to experience.
What are the things I think that people misunderstand about the hospice the most?
So many things, like you said, the old hospice, I think people have in their minds, if I come onto hospice, I'm giving up or I'm only going to live a few more days. A lot of people
Right.
kind of have those misconceptions, but definitely doesn't mean giving up. It's just shifting the treatment options, just shifting the focus onto comfort and how you want to spend however much time that you have. Another big thing that we hear in hospice is that we take away all of your medications, which is not true at all. We don't even have that authority. We actually work really well with the community physicians, and patients can decide. I've worked with this doctor for many years. I want to keep this physician in the community. And they have every right to do so. And then our doctor can work alongside that doctor as far as, what they feel is a good medicine to keep, or if there's something, somebody might have been on a blood pressure medication for 10 years and now it's really not even an issue. Can we look at getting rid of that? And sometimes when we get rid of some of those medications, people actually will perk up a little bit. I did another interview recently, and the interviewer was talking about her grandmother, how they took away one medication that she had been on for, almost 20 years, and they couldn't believe the difference, just how much more alert she was and more active in conversation. So that was a really good one. We also hear that hospice is just for cancer patients. When in fact, there's lots of different diagnoses that people might come onto hospice for, lung disease, kidney disease, liver disease, many things for that. And then as well as, sometimes people think, you have to go to a facility to get hospice. They say, I want hospice, but I want to stay in my home. Well, most of our patients are actually located in their homes, and we actually go out and care for them right there. We do take care of patients in facilities like nursing facilities and assisted living communities, but the majority of the patients that we see are just right in their homes. And that's where we really can do our great work, because we can come in alongside of the family and train them on how to, maybe how to transfer someone from the bed to the bedside commode, or how to Hoyer lift, or changing oxygen tanks, things like that, that we can help with to keep people in their homes if that's what they want to do.
I know that you're going to shiver every time I say this, but it's just where my information comes from. That was the other fascinating thing about covering hospice as part of like the death care community, because they're working on building a continuum that starts with the hospital and ends with the funeral director kind of thing, or the death doula, kind of a way to bring people all the way through it. And one of the things that they were saying to funeral directors is there are probably 50 hospices near you because they're not all in these great big buildings. Hospice is increasingly something that takes place at home, and it's not because people are too lazy to make buildings. It's because it's an effective way for people to remain comfortable as they, get toward the end of life.
They don't want to leave their home. They want to be home where it's comfortable and familiar. They want to be with their pets. They want to be with their families. And the vast majority of those folks were able to do that for.
How do you get into hospice? Is that the right question? Is that something that you ask for? Is that something that you're diagnosed for? Is that something that, you had said admissions that you're in
Yeah, Access is our admissions
access, right?
department. Yep, that's okay. And really, probably not known by many people, anybody can make a hospice referral. The funniest one I remember, not funniest, but most unusual one was we had a patient's mailman make the referral because they could see that the patient day after day was declining and they really just wanted to try to help. So anyone can make a referral. We have many people that are referred by their own family members or even sometimes by themselves.
I'm sorry, I have to stop you there. So the mailman calls and says,
Yes.
"Send me some hospice over the 315."
Right. Yep, absolutely. That is what happened. But anyone can make that referral. So when they make a referral, we will, if it comes in by way of a family member or a patient's friend or themselves, we'll contact their physicians and we'll get some records on them and we'll be able to determine eligibility for hospice. And most often, referrals and documentation do come from a medical facility or a medical provider. But it's really funny that most people don't realize that anyone can make that referral.
And what does it take to make the referral? Like, when the mailman said, did you say, there must be questions. It can't
Yeah.
just be, okay, well, we'll send somebody right over.
Right. Definitely questions. The first one is always, do they know that you made this referral? If not, our conversation with them needs to go a little differently.
Right.
But yes, there are a lot of questions. We have intake questions that we do ask because we do have to prove eligibility for someone to come onto hospice. And that eligibility is that they need to have a life-limiting illness that is projected to be have a prognosis of 6 months or less. Now, of course, that's not always what happens. Nobody's got that crystal ball, but that is the best guess that we do require of our physicians to certify. They have to be ready for comfort and have moved on from a point of view of cure. We're all about comfort. We're no longer trying to cure what that disease is. We really honestly pay very little attention to the disease. A person who's been going through treatments or aggressive care for a disease has been the lack of focus for the medical community. The disease is the focus. We're putting the focus back on the patient and back on the family. So where we do treat symptoms of their disease, we are focusing on them as a whole, very holistic type care. And we just need to do some paperwork when somebody comes on to hospice, agreeing to those things, just that, yep, this is what I want, and let's move forward with it. So we gather lots of documentation, run it past our physician, make sure that we do have everything in place, and then we send a nurse out to visit that patient and family and explain a little bit more and bring them on service. And it's as easy as that, and it can happen on the same day.
And what do they need to explain to the family, do you think? What are some common things?
Oh, there are, we actually have a patient handbook that we leave with them so
Oh.
that they're able to refer back to things. But because, when someone's coming on to hospice, this is a really highly stressful time. There's a lot of information going on. You can't, they can't retain everything at one time. So we do leave them with a really nice handbook so that they can refer back to things. But, some of the things are how often a staff will come out to see them and what do they need to do to provide that care to their loved one. What do our medications look like? How do you contact us in the middle of the night if there's a problem or a question? So there's a lot of information that we need to go over with them. And we try not to inundate them with every detail on the first visit.
That's interesting. So if there's some sort of Well, I mean, if there's a crisis, you call the hospital, right? But if there's some sort of, you have people on duty 24 hours in case there's a significant question that a family needs to have answered.
Yes, and we have them always call us. They don't need to call 911 or the hospital. They would just call hospice. And yes, we do have staff available for receiving phone calls and for visiting if need be 24/7.
And you mentioned the 6-month thing, and so now I'm going to tell you a tasteless joke. Somebody, I was speaking with a hospice executive, and he said, "I don't know, I don't know how Jimmy Carter has been able to stay on hospice for the last 10 years."
Well, yeah,
Sometimes 10 years is a long time. A long
it's
time.
a long one.
But we have had people on legitimately for
Mhm.
well over 6 months, a couple
Yeah.
years sometimes, because they are declining. It depends on what type of diagnosis you have, because certain ones, like neurological diseases, they progress much slower. But as long as somebody is demonstrating a decline over time, they can stay on hospice for as long as they need to. We don't kick somebody off just because they're still alive in 6 months.
Yes.
Oh, okay. I didn't know if they were going on and off and on and off, because that was the impression that I had gotten at the time. Where if you're not, if you take too long to take your next step down, then you'll go off hospice and then come back on hospice later when you start redeclining.
And that can happen too,
Oh, all right.
someone who, it just all depends on the trajectory, the disease trajectory, and what's going on with the patient symptomatically. But yeah, sometimes people can, they can get a little better, they can perk up, and then they may be discharged off hospice. We call it graduating from hospice when they're doing so well that they really don't need us anymore, in accordance with Medicare guidelines. So they may come off for a little bit, but then if they are declining again, if they're showing symptoms that need our services, then we can certainly take them back on our services. That often happens too. But yeah, a lot of people are surprised at, they go on hospice. And again, for some reason, I always hear like a 3-day, you live 3 days, you live 5 days, like somehow we know you got to come on hospice because you're going to die in 3 days.
Mhm.
But you hear, well, my grandma came on and she lived only a week, things like that. When that happens, it's a lot of times that person could have really come on a lot sooner than they did.
Uh-huh.
What happens is, they could have been referred, probably quite a bit of time ago because of their symptoms, but maybe they were continuing to get aggressive treatment right until the end, or they were continuing to go to the physicians and seek different options. But, statistically, someone that comes on a hospice care actually lives longer than someone who doesn't. It's about 30 days longer statistically that someone that is on hospice lives as opposed to someone who's not, for people with similar diagnosis. So it's definitely not the death sentence, so to speak, that people kind of have in their mind sometimes as to what goes on with hospice care.
Hi, this is Tony Russo from the Pines Cast, and I wanted to just take a second to talk to you about possibly sponsoring the podcast. The Pines Cast is special not only because it is for and about ocean pines, but also because listeners pay attention. Not only that, but the shows are essentially evergreen, so every week we have new people not only discovering our shows, but going back to listen to previous shows that might interest them or that might feature someone they're interested in hearing about. That means any branding message you want to deliver will continue to be delivered whenever that show is played, even after your sponsorship opportunity comes to an end. To hear more about our sponsorship opportunities, please reach out to us at info@oceanpines.org. That is info at oceanpines.org. It's interesting because let's get back to it's the show.
Almost
Almost as if the fear of going to hospice to die makes people
Yeah.
not go to hospice until it's too late, and then they go to hospice to die. But that's not what it's for.
No, well, that's a self-fulfilling prophecy.
Right, yeah.
Think that you have to, people go on and they die in 3 days, so I'm not going on yet because I'm not ready to die. So they wait so long that they come on and in 3 days they die. So it really is, it's just kind of like a catch-22, I guess you'd say.
I remember there's a silly part in a movie where a guy says that he's going to start sleeping in his chair because people always die in bed, but you never hear of anybody dying in their chair.
Yeah, exactly. It's like, you know,
Oh
yeah,
gosh.
so poor.
And what are the benefits of hospice as far as making final preparations and starting to come to terms with the fact that, this person isn't going to live 40 more years,
Yeah.
Mhm.
I mean, there's a lot of different things, for the support. Again, the support for families and caregivers is huge to be able to, either way, if someone's living at home with their loved one or the caregiver, even by themselves, that's how they're living. And so whether or not we're involved, it's going to be helpful if we are and maybe not so. So just having that support for families, they're receiving these coaching on how to care for their loved ones or, what to look for if someone is, having symptoms that can't be managed at home, what is it that we can look for? When do they call our nurse or when do they, need to seek some extra help from us? Also, just the emotional supports from the start really help to reduce the stress. Someone to come in and just be there with the patients. Our staff are just so great at feeling, these emotions alongside of these families because, they're not only learning how to care for their loved one, maybe, but also, how to start saying goodbye. And that's a really difficult thing for people to accept. Something else that's really helpful is respite services. And not everyone is familiar with it, but respite care, Medicare actually pays for hospice patients to have 5 overnights of respite care where they can go to a skilled nursing facility or one of our inpatient units. We have Coastal Hospice at the lake in Salisbury, and then we have Mackie and Pam Stansel House right here in Ocean Pines. And people can go there for respite care. So they can go there and be taken care of. I had a lady not too long ago that stopped me and said, "Yo, you work for Coastal Hospice, right?" And I said, "Yes." And she said that we were the reason that she was able to go to her son's wedding because she'd been taking care of her mom for many years before she was even on hospice care. And when she came on hospice care, she really did not want to leave her mom, not even for a minute. Her son was getting married in a different state. And so she was just not going to go to the wedding. She was very sad about it. She said the nurse talked to me for a while about it and how important it was for me to take care of myself as well as my mom and to be there for my other loved ones. And, if this was something I really wanted to be able to do, we can make it happen. So they talked to her about respite care for a while. Finally, she decided, yes, I'm going to have my loved one go to one of the inpatient units. And she went to Coastal Hospice at the lake. And she said, I called every single day for 3 nights while my mom was gone. I called all day, every day. And they never got tired of hearing from me and asking, how my mom's doing and what's going on. And she was just so appreciative for that time. Her mom had since then passed, but she was so appreciative for that time because it gave her time, obviously, to be there for her son on his wedding day, but also just a little reprieve for her that she didn't even know that she needed until she took that time. So she came back kind of refreshed and ready to continue caring for her mom. So respite is just a huge advantage to hospice patients.
Mhm.
And that must be something that families also need to be prepared for, like getting lost in how much effort it takes so that you don't notice it. But there's also probably that hard stop when the effort is gone. I don't want to say it's like a weight being lifted, but it's like restraints maybe being removed. Like you don't realize how much time you're spending until you don't have to spend the time.
Absolutely. It's caregiving is one of the hardest things that many of us will ever do. And so just having the supports from the Coastal Hospice staff is just huge.
If you're not, I mean, this is a very naive question, but I can't find a better way to put it. If you're not sure whether or not you're ready for hospice, like how do you broach that conversation with either with a loved one who you think might need it, or if you're wondering whether or not hospice is going to be more effective than continuing with your current? Is this something that patients tell you, or is this something that you tell patients, I guess?
I would say this is probably a pretty easy one, actually. There is much to be gained by educating yourself. It may not be time for hospice yet for yourself or your loved one, but do some research. Give us a call. Talk to us about, what hospice is. In Access, we have 5 Access coordinators who do nothing but process referrals and talk to patients all day long. We get calls, just an inquiry. We get calls from people that are asking us, is it time yet? I want to be prepared. They're very forthright in their thinking, and they just want to be able to educate themselves. So we have our coordinators that will talk to patients and families over the phone. We have our access nurses who will go out to the home just for an informational meeting, just for a session to have a Q&A. We'll have them go out to the home for as much time as someone needs us to, in order to give them all of the information and answer all of their questions that they have. We want people to do it when it's right for them. That also gives us the opportunity to have a little bit of a bird's eye view on the situation and be able to guide them. Our nurses are very good at understanding when somebody will meet criteria and when they actually are physically ready for hospice. And by the way, most people are physically ready way before they are emotionally ready. So if someone refers you to hospice, one of your providers, trust me, it's time, because they don't make that mistake too early.
Right. And
So yeah, we can meet with patients and families and explain everything to them in their own comfortable environment.
there seems to be like an amount of autonomy that comes with, choosing hospice when the time is right, because then it's all about making decisions instead of undergoing treatments. Does that sound right?
Absolutely. It's one of the most empowering things you can do, because, as I mentioned earlier, when someone's going through a very serious illness and they're seeking out the medical community, they, meaning the medical community, are focusing on that disease, and they're telling you what you need to do. They are not giving you the power. They have the power. Your disease has the power. But when you come onto hospice, you are in control as the patient and family. You are then empowered to make decisions, to let your goals and your wishes known, making the decisions that are going to be best for you, even if that means that you want to stay home, you don't want to go back and forth to the hospital anymore, you don't want anything aggressive done, you just want to be home and you want to be comfortable. And it's on their terms now. And that is a huge turn of the control in the situation.
Excellent. And we are coming up, we're not right at the end. We have some time, but I don't want to deprive you of saying anything that I haven't gotten to yet. So I'm going to ask my last question a little early, which is there anything I should have asked and didn't, or something that you thought you'd get to say, but I didn't provide the opportunity?
What comes to my mind is just kind of tacking on to what Nancy said, having patients be able to kind of know about us before they actually need to. It's better for you to kind of have all that information and gather it and saying, you know what, here's hospice. It's a tool if I need to use that. Because a lot of times the patients that we're getting are in crisis mode.
Hmm.
And it, can be towards the end. And then we really don't have the time to make sure that they get all those supports. When we have hospice sooner, we have more time for the whole team to be involved sooner. We can manage those symptoms at home. We can take care of someone that's in pain or has a lot of anxiety, or do things to keep them out of the hospital so that they don't have to spend their last days there.
Just to give you an example, and I'll make this quick, but
No,
just
take your time. We have plenty of time. That's why I asked it early.
okay. Just today, before I left the office, we had an admissions nurse go out to see a patient who was being admitted today onto hospice. She walked through the door and the caregiver said, I think she's gone.
Mm.
So people, like Lauren said, people choose hospice too late. Now there's what could we do for that patient? What could we do for the patient and family when they come on to service? This poor person didn't even make it on at all. But what happens? How do we support them when it's the last 24 hours or 48 hours? How do we get their symptoms managed when they are in crisis, like Lauren said? And it's so much harder to bring somebody back to having their symptoms controlled when they're completely out of control.
Mhm.
So giving us the time to be able to do what the family and patient need it's what hospice is all about. And we just ask people, please just consider it and please think about it before it gets to the point of a crisis.
You did kind of pique another question of mine, which is it? I suspect the answer is no, but I'm going to ask it anyway. Is it ever the case that people that you're like, you know what, I don't know if you're ready for hospice yet? Like,
Hmm.
does that happen?
Oh, yes, most definitely.
That's
We do.
great.
Yeah, we get referrals sometimes. More often than not, they're from patients themselves or family members,
Hmm.
and they're not quite there yet. So we actually we have another program that we can talk about another time if you like, our palliative care program, and that is sometimes for those folks that are just not quite ready for hospice. They're not quite within the 6-month prognosis. They're a little bit longer. But we have services for them as well. But yes, absolutely. People do get referred a little bit too early, but that's a great problem to have because
Mhm.
then we've got a baseline. We know where they are now. And
Right.
comes time to follow back up, we know if they've declined and if they're ready.
Excellent. And that is all I have for you. Thank you so much for sharing your stories with me. And yeah, we'll come back maybe in the fall, talk about palliative care.
Oh, that would
Yeah,
be
that'd be
wonderful. We'd
great.
love that.
Yes, absolutely.
Again, make sure you check the show notes for links to Coastal Hospice if you have any questions or if you want to send this information along to someone else who could use it. I'm sure that they would be happy to have it. This is an important thing that many of us have to, eventually will deal with. As always, I welcome feedback at my email address, which is bytonyrusso@gmail.com. That is bytonyrusso@gmail.com. The Pines Cast has been an Ocean Pines Association production. It was written and edited by me, Tony Russo, executive producer, Sarah Ash. We have more shows coming up. We are looking forward to all the stuff we'll be bringing you in the spring. Again, if you have anything you'd like to see on the show or any suggestions about things we should cover, let me know. I am always open to new ideas. And we will catch you next time on the Pines Cast.